Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at BPD, welcome and thank you for joining us for the Future of the Health System Chief Marketing Officer. What began as a quiet elimination of chief marketing officer roles across top health systems is now at a critical turning point. Healthcare economics, financial pressures, and the rise of AI are forcing healthcare marketers to adapt to new realities or risk dwindling influence, budgets, and job security. The risks are real, but so are the opportunities. Today's webinar is all about how to adapt, lead, and thrive in the fast-changing environment. With the help of three experienced healthcare marketing leaders, we'll explore how to track and communicate marketing performance, align with organizational goals, and present data that speaks directly to the C-suite. One quick note before we begin. If you would like to ask a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our panelists will respond to as many questions as they can in the time we have. With that, I'll turn the program over to Chris Bevolo, Chief Transformation Officer at BPD, who will be leading today's discussion. Chris?
Thank you, Daniel. Welcome, everybody. We're excited to get going here. Let's give you a little bit more breakdown on how this hour will go. We are going to have some introductions real quick here. Then I'll spend a little bit of time setting the table, not too much time, about the study that we're going to base our conversation off of, how we came to that, what the inputs were, a little bit more on what Daniel referred to in terms of some of the issues that we see CMOs and marketers facing. We're going to spend the bulk of the time, however, on the opportunities. We really want to work with Andy and Christine to dig into what can you do moving forward, despite some of these challenges, to really build a stronger position for yourself and for your team in terms of marketing and health systems. So with that, let's dig into some introductions. And Christine, why don't you kick us off?
Great. Thanks, Chris. Glad to be here and glad to be here with Andy. So I've spent most of my career in higher ed and healthcare, and the bulk of that in the not-for-profit space. I'll give you just a little bit about who is Baptist Health. So Baptist Health is one of Florida's largest healthcare systems, and we're actually the largest here in our region, in the South Florida market. We span from basically Key West all the way up to Palm Beach, with our sights set on further expansion. We got 12 hospitals. We have hundreds of outpatient locations, 30,000 employees and physicians, and an expansion that includes new hospitals, more locations, lots of outpatient medical centers, off-campus emergency departments, like everybody's doing in our space, and a lot of growth in our retail service line as well. We're very fortunate here in the South Florida market, which is experiencing a huge population growth. Thank you, New York, and the Northeastern area for that. And we're also seeing really an economic boom. What does that mean? For our industry, for our organization, it means competition is definitely heating up in order to meet that increasing demand, both from a local and regional competitive standpoint, but also new entrants into the market. And that makes our job hard, but also really fun, because it just sets up, all sorts of new challenges. And as crazy as it probably sounds, I've been doing this thing for 25 plus years, and I'm still excited and driven by very purposeful work. And I think we have a huge opportunity. Just that holy grail is still to build a better healthcare experience, because it still doesn't work for most people. And that's a part of the challenge I think that Andy and I face, and many others, right, in our roles in our organizations. And I'll toss it over to Andy.
Thanks, Chris. Hey, everyone. My name is Andy Chang, the CMO for UChicago Medicine. And most of my career has been actually spent outside of healthcare. But it's been an amazing world full of opportunity, which is why I've stayed and been here now for 8 years. At UChicago Medicine, we are a $3 billion healthcare system based out of Chicago, obviously, and part of the University of Chicago. We're also encroaching and being encroached upon with our competitors, because it is becoming a very crowded space and facing a lot of challenges that are similar to everyone else in the industry, whether it's from a payer standpoint, government standpoint, customer, patient, provider, what have you. So there's a lot that we're all going through at the same time, and hopefully what Chris and I can talk about will be able to shed some light and be of some value. Thanks for having me.
Great. And hello again, everybody. Chris Bevolo, Chief Transformation Officer at BPD. If you're not familiar, BPD is a strategic growth partner that delivers the future to healthcare's leading brands. So we offer strategic advisory consulting, brand marketing, communication services, and data and analytics solutions. We work with some of the best brands in the space, including our friends at Andy and Christine's organization. So really excited to dive into this. Just a little background. You will all get access to this if you haven't already seen the study that we released a few months ago called The Future of the CMO. That's what we're going to be basing a lot of the conversation on, as I mentioned before. This is actually something that started about 2 years ago, almost to the month. We first started looking at some new challenges. This has always been a challenging place to be. I've been working with hospitals and health systems in terms of marketing communications for, I'm now at the point where I can measure that in decades, which is, I don't know if that's a good or bad thing, but it's always been a challenging place to be within health systems. But we started recognizing some new issues that were really rising and causing a threat to the CMO role specifically and to marketing. And have been studying that for the past 2 years and had lots of conversations with a lot of CMOs like Andy and Christine. We've had panels on this. We actually did a study where we talked to 36 CMOs and about a dozen CEOs in the fall. And we also had a group of about 40 marketing leaders come together in December with this as the primary focus. So the study that we put out that you'll have access to gets into all of that. Real quickly, what are those issues? Because that really helps set up what the opportunities are. And there are a number, but there are 3 primary ones. The first is financial pressures. Okay, so we saw maybe the worst financial year for hospitals and health systems in 2022. Coming out of COVID fully, everybody was experiencing that. And we thought we were through it, but now they're back. And for all kinds of reasons that I don't think I need to get into, we are seeing institutions across the industry really facing difficult financial pressures. Not all of them. And this is one of the things that's interesting about this trend, where the industry used to kind of move as one. Now you're seeing almost a bifurcation. You're seeing more of a kind of winners and losers in terms of financial. And there's all kinds of reasons for that. But those pressures are lending to pressure on marketing, because as we know, unfortunately, a lot of times when leadership looks at cost cutting or financial straits, they think, well, marketing, we can get rid of marketing, right? They don't think the way most folks think outside the space, which is we need more marketing. And so that's something that is elevated. So that's one. The second is what we call kind of the pig through the snake. So the historic demand for care with boomers moving into their prime years, needing care, which everybody saw coming. Like, that's not new. What I don't know that everybody saw coming was the historic crunch on supply of care, specifically related to labor, right? Nobody saw COVID coming, which is where it really started. We knew there was going to be nursing shortages, primary care doctor shortages, but that continues today. And what that has led to is a lot of health systems not being able to move patients through. You might have to wait 4 months, 6 months, 8 months for an appointment for see a specialist. And we have definitely heard CMOs share that they have leaders who say, look, if we can't get patients in the door that are coming to us, why do we need to spend money to attract more? Why do we need marketing? So that's a new kind of angle that we're hearing. And then finally, AI. We're going to talk about AI in the positive, but as AI grows in terms of its adoption, it's going to apply more pressure on marketers, most likely to do more with less. It's not going to replace marketing in any way, but again, couple that with the other things that we're talking about, and you do see budgets cut in many cases, staff cut. We have seen the CMO position eliminated. I think we're up to about 15 that I know of. And again, I've been doing this for a long time. I can't remember 1 or 2 over the last 20 years where the position has been eliminated. It's different than somebody being let go or whatever. We're not going to even have a CMO anymore. So that's the kind of setting behind this. So everybody has the background. Now let's get to the opportunities. What can you do about this? And this is where we're going to really hear from Andy and Christine. And we're going to try to get through all 5 of these in the time that we have together. We should be able to do that. But if Andy and Christine get super excited about any one of these and just go back and forth and we have a really robust conversation, we may not get through all 5. And if we don't, that's fine, because again, everybody attending will receive opportunity to get the study itself, which goes into depth in all of these. All right. So with that, let's talk about opportunity 1, which is the idea of becoming the voice of the market. And the vernacular here, the semantics really matter. When we were, both Christine and Andy were with us in December, and there was a very interesting conversation about marketing kind of falling out of favor with many leaders. And some of that's COVID, some of that's the reasons we talked about. For example, maybe replaced by comms in terms of value. And we had a speaker who suggested, look, if you want to raise your profile and your value, you should become the voice of the market. And what is meant by that is going beyond just the voice of the consumer, which we've talked about in this space forever. That's part of it. It's really trying to understand the other dynamics that impact success and growth of your organization. And Paul Keckley is the person who came up with this. If you're not familiar, he's an amazing guy who gets into healthcare economics and really understands what's going on out there. And the example he gave was the housing market has more to do with the success or not financially of a health system than maybe our own marketing efforts. Meaning the housing market is a reflection of interest rates, the economy, unemployment, all these kind of things. If you're looking at that, that may tell you as much or more about what's going to be coming for your system. So really getting outside and understanding, even beyond healthcare, some of the dynamics that shape our organizations. That could be economically, that could be culturally, and then finding a way to share that with the CEO and, if possible, the board. Because those are the folks that really need to understand that, and they're likely not getting that picture from anyone else. And if you can come in there and provide that voice of the market, they may see you as instrumental in understanding where things need to go, where to expand, your strategic planning, all of those things, not just what the next campaign is going to look like. So I'm going to throw it to Christine first. Christine, what's your reaction to that? I'm going to stop sharing so we can see these folks' largest life, and then we'll get back to the deck and we move to the next one. Christine.
Perfect. Thanks, Chris. I think from our roles, right, we have this unique ability in our roles as CMOs. Now, I happen to have, unlike I think Andy, right, so I happen to have communications under me as well. So it's a CMCO, so we have marketing and communications, but we have an amazing ability, right, to be this connective tissue, to understand sort of those market forces that you described and be the translator between those market signals and how that should walk back over, be connected to strategic priorities, right, for the organization. I report to our chief strategy officer. That might be different, from other organizations and other roles, but we are in lockstep with our strategic planning partners, looking for those types of market signals. And it's a really good example that you talked about housing. Housing in the South Florida market is exploding. Again, I talked about that, population growth, that economic boom that we're having. We as an organization are in a fast expansion mode, just trying to keep pace with that increasing demand. And then, you referenced it before, how do we actually meet that demand operationally with a bit of a crunch on that access point. But I really believe that we have that role of that sort of outside in perspective. And I would share with all of our colleagues, listening and watching, that you cannot underestimate how siloed we are, how insular we are as organizations, that we believe, right, especially at whether that's at the CEO level, executive levels, board levels, that their experience is the same as the average patient's experience. It couldn't be any different because they, in a certain set, right, are getting expedited care, they're getting a smooth experience, and we have to come in consistently at every leadership conversation and remind people that that is not the average experience, and that these market forces, these organizational dynamics, these consumer behavior dynamics, we have an opportunity to put that story together, and help tell that in a much more, I think, cohesive way. And again, take those market signals and translate those over to where should our priorities and our focus be.
Andy.
The very similar answer from Christine, except we are in a shrinking market in Chicago. Our population is actually declining because they're all moving to Christine's market. And the issue we face, though, is still the same. It's we have a shrinking market overall. Our delivery volumes in the market are going down, but the need for healthcare still goes up. And with that being said, it is our job as a marketer to become not only the voice of the market, but also the voice of the customer, and make sure that you are representing that voice in every single meeting you are in, to remind all of the stakeholders why we are here in the first place and what is that perspective. Kind of like what Christine just talked about, everyone goes through the same healthcare experience, sadly, but we have to constantly remind people how bad it is all the time, and it is our job as marketing staff to always just make sure that the voice of the patient is in every meeting. The way that we frame it from a marketing or market standpoint is we use an acronym MCCU here at UCM. It's the market, competition, customer, and the last U is for UCM. And so the marketing team, they put together what we call fact books to understand what is the market, what is it comprised of, what is the population like, et cetera. The competition, what do they offer, what are their differentiators, how many of them are there, what are they doing? Our customer, which could be referring physicians as well as patients, who are the patients that we're going to try to win over? What do they need? What are they looking for? Same as our referring physicians, and then lastly, what do we have to offer from a experience or differentiator, and ultimately a unique value proposition? What do we have that could really make us stand out? And all of that culminates into how do we become the voice of the market at the end of the day, and make sure that is presented to as many people as you possibly can, including the CEO, and hopefully it's compelling enough that it is new information that people will use, and that the board will then help understand this is what the market is really like, and remind them from the perspective of the patient, this is how they see us and this is what they experience. So there's a lot of similarities that Christine just said, but we look at it from more of a well, I look at it more in just a frameworky type of way.
If I can follow up on what Andy's describing too, is, people would probably wonder, like, well, how do you demonstrate this, right? For people, is, data, but I would bring that to life with real world examples, right? And real stories and real recordings of how people, right, experience healthcare, which is, again, not the same way that our key stakeholders and leaders and executives and board members experience it. It's just not. And so we would bring forward not just, oh, we couldn't get X number of people in. It's listen to this voice recording of this desperate patient or family member, and you begin to help people understand. Again, we're talking about both voice of market and voice of consumer, but they're together, right? They coexist, but bringing forward, I think, those real examples in those leadership conversations to kind of break through that, again, that very insular thinking that is, commonplace in healthcare as an industry. We're very resistant to believing that, that other industries are anywhere like us. The fact is, the customer interacts with all sorts of different industries and services and products, and we have to elevate and absolutely dramatically change what we're doing. We're not that much different, and the customer happens to be the same, whatever they're buying, including healthcare services.
Yeah, that's great. And I think what's interesting about this is if you think beyond the voice of the consumer, because there's so many ways to measure that, and to the voice of the market, you can have a little bit of fun trying to explore different ways to bring, value through understanding different aspects of it. And I'll give one example, then we'll move on. We have been watching the growth of the ICHRA. If you're not familiar with ICHRA, I have to always look up the acronym because it's crazy. It's a classic health insurance acronym. It's referred to as the acronym is the Individual Coverage Health Reimbursement Arrangement, which is awesome. It's called an arrangement. Essentially, what this is based on a tax decision in 2019, where companies who receive tax benefit from having a health benefits plan for their employees were told that, hey, you can also have a tax deduction if you just give those employees a sack of cash and send them out to the ACA. All right. And so we have seen the growth of the ICHRA. It's kind of like the shift from a defined pension to a 401k back in the 70s and 80s. The implications of that for providers could be profound because everybody is concerned about payer mix, right? Everybody's probably completely aware of the challenges of payer mix that are coming with potential Medicaid cuts. But if we see more people that are commercially insured move to the ACA market, that's a different game, right? They're not self-pay necessarily, but we all know there's all kinds of variances with coverage in the ACA. There's other plans that people can have access to that aren't terrific, and that will just put more burden on providers. It's also not great for the consumer because now instead of having an employer behind you when you have an issue with your health insurance, now you're out on your own, right? So are you monitoring this in your market? Are you seeing our big employers adopting this? Because you have a major employer in your market that decides to move to an ICHRA, you just could have taken 5,000, 10,000 people off of commercially insured and sent them into the ACA. So what could that mean for you? That is an example of something to watch that is flying under the radar. All right, so let's go to opportunity 2. Do this deftly. There we go. All right, so this is about span of control, and this was super interesting. What we mean by span of control is, what are you responsible for as a CMO? Of course, it's marketing. You heard Christine say comms for her, so a lot of CMOs, and Andy has comms as well. Some folks have experience. Some folks are responsible for strategic planning. There's about a dozen things that CMOs could be accountable for leading. And in the study and in the conversations, what was interesting was there was kind of a split among CMOs. You had those that were going for the land grab, meaning the more things I can own, the stronger my position, the more value I can add, right? Seems intuitive. But there was also folks that felt very passionately that we're going too far. We're stretching too much. Like what I remember at the Joe Public retreat, and Christine and Andy, you might remember this. We brought up the idea of should CMOs own the experience, and one person like literally jumped out of her seat, and she's like, "No, absolutely not." And her point was, we take our eye off the ball, or it's kind of like jack of all trades, master of none, if you have too much. So there was a voice of folks that said it's better to focus on one thing and do it really well. That's going to get you more value. And I think the takeaway for this is neither one of those is right or wrong. The idea is that you pick a path and you purposely build strength in that path. So you don't let it happen. You don't kind of fumble around in the middle. You pick a path. Are you going to focus on one or two things, or are you going to try to expand your purview? So this will be interesting to hear from Christy and Andy on their takes on this. Let's hear this one. Andy, I'm going to throw to you first.
Yeah, I remember this conversation between the land grab and the power of focus. I think the key word that we talked about, and that what you just said, Chris, is being able to demonstrate value. Because if you are able to be successful and you're the one but can't demonstrate value, then it doesn't matter at the end of the day. So, you know, to me, these are both viable strategies in the sense of trying to make marketing relevant in a health system in a day and age where the value of marketing is always being questioned. And by the way, this doesn't happen just in healthcare. This happens in every industry. But it doesn't change the end goal of making sure you are able to demonstrate what are you bringing to the table and why you should be considered as an investment with a return, as opposed to just a cost center that makes people feel good about themselves. And by people, I mean our own healthcare people, ourselves. And so to me, it's more of a personal choice, personal preference. One tends to be more aggressive. One tends to be more insular. But at the end of the day, like I just said, it's all about bringing value and demonstrating real, true financial value that others outside of the marketing world will be able to understand. And that's usually in the form of dollars and cents, not impressions and clicks. It's dollars and cents. And then lastly, none of these are going to be even possible if you don't build the right relationships with your colleagues outside of marketing and inside of marketing, of course, because they have to be able to trust you that, yes, you are someone who we should, you know, improve not improve, excuse me, enhance or increase your span of control, or yes, you should be someone that I really trust you with and give you more resources for this one thing. That really starts with trust, and trust from your boss, trust from your peers, trust from your own team, whoever you need to work with, and that all starts with relationships as well. So those are the two things, value and relationship building, that are just absolutely critical in whichever path you choose.
I'll pick it up because that's a great point that Andy's making about these relationships. I think it sounds like, well, you know, like a no-brainer. Well, of course you would have, you know, relationships with your colleagues. If I may, Andy, I think what we're talking about is like really building these coalitions of partnerships, right? These are people that you are going to co-develop things with, right? It's not just being nice to your colleague over in HR, but it is literally locking arms with HR or IT or strategy or whatever, you know, whatever those, you know, components are, and being viewed as a co-builder of something, not, I think, and, you know, we've all, you know, experienced this over many years in our careers, you know, marketing and communications, you place an order, right? And they, and you get something from marketing and communications. I really, really believe in what Andy just described, is this idea that we are a business strategist. We are, you know, sitting next to our colleagues, you know, defining things together, building things together, and then we all go off in our, you know, in our respective areas and disciplines to do our parts of that. And I think when we talk about, you know, what can we do in terms of my role, you know, marketing communications, I also think of that as being sort of, you know, architect of growth strategies, architect of experience strategy. It does not mean necessarily that I own the patient experience. I am sitting next to my person who is over PX, but I think of that as, you know, sort of CX and PX, as the consumer experience before they come into the health system. She and her team pick it up with their deep, deep collaboration and coordination to ensure that we're thinking about, right, that brand promise is actually being, you know, delivered in a lived experience, every touch point, every, you know, every time, every channel. I'm not describing this as being easy. But I am somebody who leans toward intentional land grab, and if not land grab in terms of full ownership, definitely influencer, right? A chief influencer in that area. And going back to being representing, right, voice of market, voice of customer. I think it's just it's essential. I'll give you an equation that we use, right? EX plus PX equals BX. And I'll explain what that means. It's a very quick reference for us to say employee experience plus the patient experience equals the brand experience. And most recently, we kind of added in MDX to that because the physician experience, especially those, right, from an employed physician standpoint, is also essential to that equation. We're not even talking about, campaign, none of that. We're talking about how those building blocks total up to represent the brand experience. And we've spent a lot of time, and Chris knows this, really re-educating our key stakeholders, starting with my CEO, to begin to change their mindset about what is marketing and communications supposed to be doing. It is really around sort of getting rid of that legacy view of, we make campaigns and yes, we drive growth, right? That's why we exist, but it's also understanding how we are, I think, connectors of these key pieces inside the organization that we can build toward the brand experience, that brand vision that we all talk about and strive for, and the delivery of that. If I can give a very quick, concrete example of somewhere where maybe you wouldn't expect marketing and communications to show up. Very short example, urgent cares. We have been a leader in the urgent care space in our market. We have dozens of them. For 25 years, we have been a leader in this space. Some of these looked very tired and looked very old, maybe had great care being delivered as would be expected from Baptist Health. But before we began, we said, oh, it needs a campaign. BPD is very familiar with this. They're working on it. Before we just do the marketing and communications campaign, let's do a deep dive into what does the customer expect now from this category of retail service? What do our places actually look like? And then what is the experience we want to deliver that is truly differentiated? A whole bunch of people are in this market with lots of urgent care. We started with those things. We did not start with marketing is going to make a campaign. This sounds like, again, a no-brainer. Like, of course we would do that. But that's not often what marketing is leading. And it might, in your organizations, might live with strategy or operations or, a business lead. We took that leadership opportunity next to the CEO of our outpatient area and built in what is the experience, training, development. We're leading with our construction and facilities, a complete revamp of what our facilities look like and feel like. And then, right, months later, we'll launch the campaign. That, I think, is an evolving role of how the marketing and communications, lead can bring value to all of that, right, of that sort of building of either a new product or a refreshed product or how you're going to come to market.
That's great. That's great. And it's a perfect segue into our next area. By the way, as a reminder, if you got questions for Andy or Christine, please throw them in the Q&A section. But let's talk about the next one because it is really about experience. So let's do it. And I think this was maybe, Christine, you just spent a lot of time talking about how you show up to help lead experience. We have on here, this is a story as old as time. I guess maybe it's a story for somebody who's been around this industry as long as I have. I was around when the first chief patient experience officer was introduced, and I'm pretty sure that was at Cleveland Clinic. I will not give the date on that because I don't want to share how old I am. But it's been a while, and it's been up and down and in and out. And but in our study of this is one of those points that gets a lot of heated debate. And the study what we found was everybody we talked to, this is true across all of our clients, all the folks I know, all the people we talked to for the study, experience is owned by multiple people in every single organization, right? There are a lot of times people are responsible for the digital experience, or God forbid, we call it the front door experience, which I think, Andy, you've got a point of view on that. The patient experience, which might be different than consumer experience. We've seen the rise of the chief consumer officer, but that's still that we can't find anybody where one person is responsible for not driving everything, but responsible for. And the reason why that seems like an opportunity is because, everybody knows that if you share accountability among more than one person, 2, 3 people, then it's minimum going to be a little bit fractured, maximum going to be, oh, that's her job, that's his job, it's not my job. Like, somebody has to be accountable. And so the conversation has been around, well, why not the CMO, for some of the reasons you heard Christine talk about, who's got a better voice of the customer, who's got the holistic perspective. Experience can be a real differentiator. Yet a lot of folks just like, no, CMO can't ever do that. And again, it's not about like, it's doubtful a CMO would be held accountable or given responsibility solely for the patient experience, but maybe they're over it. So Christine, what I'd like you, since you dug in deep, I'll throw it to you first on kind of how you've shown up there. I know that there's a little bit of a journey that you went through to get to the point where you can influence experience. And I know you believe strongly in your role there. So why don't you share with people just a little bit of how you got to the point where that was something that you were accountable. You're not solely accountable for it, but you have a very strong role. And then we'll toss it over to Andy and get his view on this one.
Perfect. Thanks. So yeah, coming out of COVID is, a very battered, beaten up organization, like many of our organizations were. And we were really looking at sort of what to fix or repair or restore or re-energize first. And it was a combination of, at the time, our chief experience officer in her role, chief HR officer, and us. And the three things, right, these three areas really saw from each of our audiences, if you will, opportunities to really, reignite, reengage our employee audience first, right? Going back to EX, that employee experience was fundamental in, again, building them back up in order to deliver right on that brand promise of an amazing, compassionate care experience. So in a short version of it, these three areas get together. We tighten up the story. We make the case, right, to our senior leadership to say, we have to start with re-engaging and restoring culture, values, connection to purpose first. It was fundamental. And that began the building blocks of this EX, PX, BX story that, that was quite, it was multiple, months and couple of years, and continues today. It could not be also seen as, that sort of, project or initiative du jour. It had to be sustainable, and it had to be connected to purpose and culture and values of the organization. So that work began, there was a huge rollout, et cetera, but all woven through that, right? Woven through that was that we were building a better experience for our employees, then translate over to what that meant or looked like for our patients, and how that rolled up to, right, the brand experience. Key metrics thrown next to that. And I'm really proud to say that our employee engagement metrics are national benchmarks. Our physician engagement scores have continued to rise and continue to improve. Our brand metrics have continued to improve. Our patient experience scores, all of that. But it began with, I think, what Andy said before. First of all, those relationships with those key partners existed way, way before, right? This, we believed, we were co-builders of that program. We presented it to our CEO, to our boards, as this is, right, we co-own this massive system-wide initiative, which continues today, and actually needs to, continue to evolve, but presenting this as a united front around what was this common purpose, the common goals that we had hardwired, key metrics that we, follow all the time, from a patient sat, employee sat, and so on, that we were all driving together, again, as co-owners and co-builders of this major system-wide initiative. And that's how it evolved to that marketing and communications not only belonged in the room, we understand those employees, they're not just an HR number, they're customers of ours also, right? They're brand ambassadors of us also. We had an opportunity to influence what we're telling employees, and the same way externally facing to patients and consumers. That's how it began and continues today. And it's just, maybe it was just born out of, necessity after COVID, but those relationships were there long before that, and were really galvanized, and actually has elevated my role to be somebody that sits at that table constantly now as a key voice and a key influencer in how we look at the experience writ large.
Thank you. Andy, what's your take on this?
Yep. You knew what you were doing, Chris, when you said the word digital front door, trying to trigger me, and you did. Congrats. That's my least favorite word in healthcare. So I will also add that it's really tough to go last because everyone takes all the things that I wanted to say. But yeah, we bring a siloed experience. We make our patients jump through at least, I mean, just count like our website and then our phone center. That's two different experiences managed by two different departments. Then you have the appointment reminders. Maybe you're using a third party, so maybe that's three. Then you have Epic or your EHR, right? That's four. Then you have your billing, and if you're using another third party, that's five. And then, oh, by the way, there's the appointment itself. There's the maybe you have a reading material that they send you a link to. Maybe there is some other diagnostic lab that you have to go to that's not part of your hospital system. I mean, there's six. There's at least six on a basic appointment that we're making our patients jump through, and it's because each of those different areas are owned by different people, and everything is built on how that department thinks the way that particular function should go in the most efficient way possible, but they don't think of it, and by they, I mean everyone does not think of it from the entire patient standpoint, which is the entire journey. They're thinking of it vertically, but not horizontally, and we really, really need to stop doing that. It doesn't matter if you own experience or not. If you're in marketing, you need to make sure that the voice of the customer and the voice of the patient is represented. And you are telling people, so now we're making our patient go through another system. Now we're making our patient go through another system. Like, those are the things that you need to be bringing up. And the idea of making things as seamless as possible, reducing friction, that is something that we're pretty passionate about at UChicago Medicine, and just kickstarted a project yesterday, actually, to really try to tackle the entire patient journey as one seamless experience, regardless of channel. And it is comprised of marketing, IT, experience, operations, access center, I forget the word. Compliance. That's not good. Compliance, procurement. Like, it is a truly multifunctional, of course, clinical side, and we have two physicians that are also as part of this committee. It is truly trying to bring as many people into one group to force them to think, what does the patient have to go through? So there are a lot of different ways to do that, but like Christine said, and literally off my notes, you got to build those relationships to be able to accomplish these things, and then earn the trust of of your boss, of your colleagues, etc., to make sure that you are able to do it.
And I think if I can add, if people are wondering like, well, how do we do this, right? Don't just I would suggest that, don't just tell people about all those touch points that Andy and we all experience in our own systems. Illustrate it, or bring it to life for people, because they are in their own silo or their lane. And, we discovered that, we send, I don't know, like 12 million text messages out to people. We don't have 12 million encounters the last time I checked. And why are we sending 12 million? That's because somebody else, is hitting that, or many other people are communicating in a way that we're not seeing those things holistically. So actually illustrating this for your key stakeholders in a way that they can really, really see and understand would be a suggestion, because they don't experience it. They know who to call in the back, the back line. And they really don't believe it because they're just focused on their one particular area or, or function.
All right. I feel like we could talk forever about this one. It probably deserves its own webinar. We're getting to the Q&A, but we've got to talk about the next one, because I know for both of you, this is a huge passion point. So I'm going to flip to it. I'm going to set it up really quickly. And then each of you take a couple minutes, no more than a couple minutes, to kind of give your point of view on it, if that's possible, because I know this is one of your favorites. So,
and let Andy go first.
Okay, Andy, you can go first. Here we go. It's AI. And essentially, I'm not even going to set this up. I don't think I need to set it up. We're talking about AI all over the place. The one thing I'll say in there that we're starting to really advocate for is the Edison versus Einstein. And the Edison is the iterative process of improvement and efficiency. Great, do that. What we're seeing is a lack of the Einstein thinking, which is thinking in a completely new way, which AI should allow us to actually operate in a completely new way. Maybe not even today, but we know it's coming. So make sure you're not just working on how do I save an hour a day, do that, but also take some time to figure out, like, if this is really as powerful as people say it could be, how could this change fundamentally how we show up? Andy, 2 minutes, go. 2 minutes on AI. How about that?
All right, great. Yeah, this is definitely something that we're spending a lot of time on, and all of us in this discussion obviously spending a lot of time on today. I do agree that marketing really should lead the way in how AI is rolled out and educated internally. But you cannot do that until your own team understands the benefits and the implications of AI. We have, we're tied to the University of Chicago, which is one of the pioneers of this space, and the university itself has been making a lot of headway in machine learning and AI, which helps a lot in trying to convince or showcase what AI could potentially do in healthcare. But if you are not doing this today, for all 96 people that are on this call, if you are not doing this today, I highly recommend that you do. It is to showcase to your boss and to your entire team what you are doing with AI on a personal level or a professional level, to show everyone what is possible, and also show everyone that you are the one that had thought of this idea, and they start understanding, like, this big AI thing is real, and all of a sudden you become a stakeholder or a voice whenever AI comes up as a topic, and you get to benefit from that. So really make sure that you guys are doing that. I'm about to give a presentation to our ELT on AI, and I've been doing this for over a year and a half now, since I've been here, regular updates on what AI is up to, with live examples. And right now, it's not generative, it's now agentic AI. And so what does that mean? And here are some examples of what agentic AI can do. But what's coming after agentic AI? It's probably multi-agentic networks. What does that mean? What does that mean for you personally? What does that mean for you in healthcare? So how should we be thinking about our experience strategy based on that? And how do we start planning for it now? A lot of these words that are being thrown around, with MCP or not even just LLM. There's so many acronyms that are being created. You should be learning about that and watching as many videos or articles or TikToks, whatever you're into, to understand what that's about, and again, demonstrate how you're using it and how that applies in solving real problems, whether it's a burning platform or increasing efficiency, decreasing costs, which is something that we're all trying to do. What are you doing to, again, show value? And how does that translate into how this benefits the overall health system? Was that 2 minutes? I don't know. I wasn't keeping track.
It's
But
perfect. It was exactly 2 minutes.
cool.
I timed it.
All
Good. I
right.
was keeping track then.
Well, now I'm going to try to keep it to 2 minutes. Coming out of sort of last December's Joe Public, where it broke our brains in terms of the potential and the speed with which all of this was coming. We really doubled down, and I think Andy touched upon it. Before you can be an influencer and a whisperer with your executive team, first you have to acknowledge this is not a tech thing. It's not. Do not defer this to IT. Yes, you will need their partnership if you need whatever APIs, et cetera, but do not defer your learning or understanding of this to IT, especially when it comes to the disciplines of marketing and communications and what it can do, right? What you can be doing with it. We quickly developed for our own team in order to become more knowledgeable, an entire year's worth of learning series, did a deep dive into it, tied it to performance evaluation. Again, this is just inside the marketing and communications function in order for us to be viewed as people who were leading in this space, myself included. And now we are not just at the table, but we are getting tapped left and right. In fact, a colleague of mine just said to me before this, he's like, yeah, now we're like the resource for everybody because everybody's coming to marketing and communications for help in their respective departments. IT, can help set it up, but what we're trying to do is really become, implementers, integrators, if you will, interpreters of what do you do with these tools in your respective spaces in order to improve efficiency, have a co-thought leader, et cetera. This is such an opportunity. Talk about bringing value. I mean, Andy started with it, and again, not about tech. It's really about these trust with your own employees inside your department, trust, with patients. What is AI, right? That's from a communication standpoint. How is AI going to enhance or improve care? But we have quickly earned a pretty good spot as both thought leaders and leaders in our organization to be embracers of this new type of technology and how it's going to change the way we work as a department, how our workforce, right, is going to look different. And now we've got a great opportunity to continue that thought leadership in our organization.
Well done. Well done, both of you. Again, we could talk all day about AI. So let's get to questions. A couple things real quick. First of all, this was the opportunity we did not speak to. Money, no big deal. Show how you're going to bring actual, like Andy said, dollars and cents. Again, you'll have a chance to access the study to get more into that. But I did not want to leave that unspoken to, but we will not dive into it. Show ROI, find out how you're driving actual financial impact. You can follow this QR code or the URLs on the page to get contact information for all of us, to get a copy of the paper, to get a copy of this deck. But let's go to some questions in the time we have left. Thanks for everybody for sticking around and submitting the questions. Let's see. One question is about the elimination of the CMO role. And in Andy and Christine, I'll give you a chance first, but I'm not sure. You'll just have to be honest whether you know the answers. When this happens, and again, we have seen about 15 health systems where that role has been eliminated. The question is, did leadership also eliminate the functions that typically roll under that position? For example, brand, customer experience, market research, or were those just redistributed to strategy or operations or somewhere else? Do either of you have insight into that? I have a little bit, but I want to give you guys a chance first.
So not here, obviously, at Baptist Health, but I'm aware of other areas where it was just redistributed. You know, another colleague of mine, you know, here in the region, it was just redistributed. Sadly, because I don't think that is it's not going to end well in terms of, you know, that I think that brand experience for that organization, but that's the only one I'm aware of personally.
Andy?
Yeah, it is happening, and it comes in waves. This isn't the first time it's happened. It's not the last time. People will be hired back, and new CEOs will come in and fill that position, and it will, you know, it's an up and down type of deal. And it's also, again, not limited to just healthcare, but there's going to be, um, especially in times like these where there's a lot of funding that's being put at risk. People are really asking hard questions, and obviously we're biased here, and they come out with maybe not the best answer or solution to those questions. But again, what happens if the CMO is gone? What's going to happen to the health system? And if the answer is we don't know or nothing, then you know you have a problem. So it's you got to always be just trying to earn that trust and return.
Yeah, and I'll just add quickly, the organizations where I know this has happened, it's not like marketing's dissolved. It's not like they're just like, well, we're not going to do marketing anymore. Essentially, it's left to the next highest person. That could be a VP. In some cases, even VPs were eliminated, and you're left with like a senior director, where you had a CMO and now you have a senior director. But in either case, you know, clearly that is not a good situation for that organization, even if it's a VP, because that person now is probably has a different reporting. It's a clear sign of how marketing is valued, all of that kind of stuff. So typically it's all the responsibilities are there. They're just pushed down. So here's another question. And luckily we only have 3 minutes left because you guys will have to be thoughtful about your answers. Curious of the current strategies to build cross-functional work with colleagues and engage employees in light of the current impact of executive orders on health systems, organizational culture, and experience. We are spending a lot of time on this now. How do you guys handle that given the elevation? There's just so much going on right now. It's almost hard to keep up with it all. Andy, why don't you go first? If
Yeah.
you're unmuted, so I'm assuming that's a volunteering to go first.
Oh, well, I didn't realize that. But well, hey, first of all, hey, Deb, how's it going? The impact is pretty scary from a university and academic health system side for sure. Is there an impact on the org culture? Yes, 100%. And I'm going to say it's not in the best way. So it is a challenge that we are actually talking about right now. What can we do to help our teams and physicians stay focused on what matters most, which is delivering care to those who need it and to our communities? And how does that translate to experience? Well, that comes next. We actually have set goals for this fiscal year, really dedicated around experience. And hopefully we are able to keep on pushing through whatever comes our way, and really just whatever comes our way. We don't know when or where or how. Just something's going to be coming through, and how do we just mitigate and yet still stay focused? It is absolutely not just a marketing thing. It is an across the board thing, as Deb, you know for sure. But Christine, please.
That's exactly, I just to, you know, sort of go back to what we were talking about before, is this becomes more of that sort of communications culture, you know, reminding people what we do, why it matters. You know, healthcare has weathered a whole lot of storms in the past. This feels, particularly difficult, and politicized in lots of ways. But I think what we understand is at our core, right? The mission of healthcare, the purposeful work that we do. You just have to keep reconnecting people to that through good communication, through good relationships, because that's, and that our reason for existence, right, is to provide, exceptional care to the people who need us most, no matter what, storm is swirling around us.
Great. So we're at time. Daniel, why don't you take it away?
Thank you, Chris. I'm sure the audience joins me in thanking you, Andrew, and Christine for that terrific discussion. And thank you to everyone in our audience for taking the time to join us today. Please note that if you asked a question that we weren't able to get to, we'll do our best to get you a response as soon as we can. We'll also be sending out a link to the webinar recording, so watch out for that within the next few days. That concludes today's program. We hope to see you at future forum webinars, and mark your calendar for the Healthcare Marketing Physician Strategy Summit, May 4th to 6th, 2026 in Salt Lake City. Please visit the forum website at healthcarestrategy.com to learn more. And finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.